Hey everyone, my name is Caitlin O'Connor. I'm joined here by my colleague Rima Taneja. We are two members of the Nixon Gwilt Law Remote Care Practice Group or team. We actually all do a lot of other things as well, but for purposes of this video, that is what matters. If you have been following along, last week our firm did a webinar on the new remote therapeutic monitoring codes and other changes to virtual care management reimbursement under the 2022 Medicare physician fee schedule. During that presentation, we got over 100 questions from our attendees and viewers, and as I'm sure you all can imagine, it was impossible for us to respond to all of them live. So Rima and I are going to spend the next couple of weeks responding to some of the questions that we got as quickly as possible and as simply as possible so that you all can get just a little bit more detail and color on these new RTM codes. Rima, anything to add before we dive in?
No, that's it. Hi, everyone. I'm excited to dive in.
Okay. Before we dive in, I'm actually going to add, you can always contact Rima and I via our firm's website. It is Nixon Gwilt, NixonGwilt law.com. So head over to our website if you've got more questions or you want to reach out to either of us. All right, let's just do this in rapid fire fashion. First question, Rima. Do the RTM device codes have to be billed with the RTM services and management codes?
They do not. So similar to remote patient monitoring, the services codes can be billed without the device codes.
Awesome.
And I will take the next question to ask Caitlin.
Right.
So Caitlin, is RTM subject to a copay?
Yes, depending on the patient's coverage. So under original Medicare, beneficiaries are always responsible for a 20% copay, and that's statutory, that's written into law. The only way that can be changed is if Congress changes it. But Medicare Advantage beneficiaries, a lot of times will have supplemental coverage that covers their copay. So while your original Medicare Part B patients are definitely going to have to pay a copay, other Medicare patients may not. During the COVID-19 public health emergency, this is temporary, not permanent, providers can actually waive copays for RPM services and other virtual care services. So I imagine that they can also waive them for RTM.
Yeah.
Okay, next question, Rima. Are the RTM codes actually usable at this moment? Can a physical therapist apply for reimbursement to Medicare today?
Yes, so they were finalized in the 2022 Medicare physician fee schedule, and they are effective as of January 1st of this year, so they can be used. Okay, so last question. We got some inquiries about who can bill for RTM. So Caitlin, can a dietitian bill for RTM?
Yes.
What about a respiratory therapist?
No.
And lastly, can a physical therapist or occupational therapist bill for RTM?
Yes.
Excellent.
All right, that's it for this category. We are going to have a couple more videos coming at you guys, so stay tuned. There will be other categories around providing RTM with other services, and then we'll also touch on some of the questions that we often get about the device requirements for RTM. Stay tuned.